By definition, ichthyosis or congenital ichthyosis, and that's the key, it's congenital, in the vast majority of cases, is a rare disease. It occurs in less than 200,000 people. There are probably 20 different forms of the disease. The most common form, ichthyosis vulgaris, occurs in approximately 95% of patients. And it can be easily confused with just normal dry skin. So what we're talking about, even within the congenital ichthyosis field for what we're studying, is a small subpopulation of a small subpopulation of people. The disease itself can be either non-syndromic, meaning it only affects patients' skin, or syndromic, where they may have not only the skin symptoms, but they may also have short stature, they may have other problems with overheating. So it's more of a syndromic, systemic kind of a disease. The two forms of ichthyosis that we've studied are X-linked ichthyosis, which occurs in approximately 1 out of 2,000 to 1 out of 4,000 children, male children, because it's X-linked. And the second form we're looking at is a much more severe form called lamellar ichthyosis, which fortunately is also more rare. It only occurs in, or less rare, I should say, only occurs in about 1 in 100,000 to 1 in 300,000 people. But in both cases, as defined by the title, ichthyosis means scaly skin. Ichthyos, like fish scales in Greek. And that's the main symptom that you get. The vast majority of patients are going to present either soon after birth or in childhood, unless it's ichthyosis caused by a drug or a cancer, for example, where it might present more in adulthood. But the vast majority of patients are going to present in childhood or shortly after birth. And it can vary from a very mild form like ichthyosis vulgaris to a very highly fatal form called harlequin ichthyosis, which in essence, when the baby is born, they're covered with a membrane that almost completely covers their entire body, which makes it difficult for them to drink. More important, well, as importantly, it makes them difficult for them to breathe. And those babies can be an extraordinarily severe extremist in terms of the difference between life and death. If they survive, they go on to, again, one of the forms of lamellar ichthyosis that happens. They're all genetic. They affect different genes. In all of the diseases, however, what in essence, at least the non-syndromic ones, what is happening is the gene knockout that is occurring either causes the cells of the skin to bind together so they don't shed as people without the genetic disorder have, so the scales start to build up, and that's where you get the scaly, thick skin. Or you have a loss of the skin ability to fall off, and in fact, it hyperproliferates, so it increases even more. So the skin, in a sense, becomes even thicker because the cells can't come off, and there's something actually stimulating them to overproduce. The only treatments right now are really symptomatic ones. So as you might expect, what you want to do is you want to make the skin look as normal as you can. And that's mostly done with emollients to sort of smooth off the skin or help the scaling to come off. Baths that may have salts in them, which again makes the skin easier to, the scaly skin come off easier, or you may just remove it with a pumice stone. So emollients would be one thing. Keratolytics in the more severe forms, so things like urea, which actually helps the skin scales to come off. But there really is nothing that gets to the source of this overproduction of the cells, of the skin cells, or the adhesion of these cells. It's more of a symptomatic treatment.